Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Today we're talking with Dr. Arif Ali, board-certified radiation oncologist and medical director of Peeples Cancer Institute at Hamilton Medical Center. Dr. Ali, welcome to the show.
Yeah, thanks for having me.
So today we're going to talk about clinical trials and how they're now being conducted at Peeples Cancer Institute. Could you tell our listeners what they are and why they are important in cancer care?
Cancer care is advancing at, I would say light speed. I mean, there's new developments, there's new technologies that are coming out, every month, sometimes even every day. And the way that these new advances, the way that these new developments arise is through the clinical trials process. So they're important, to the field of oncology, just because that's how we advance the field, that's how we cure more people. But they're also important to patients because that means by having access to clinical trials, they have access to technologies and treatments that they might not otherwise be able to receive, treatments that are at the forefront of cancer care, that are really at the leading edge of cancer care. So for all those reasons, we decided that it's critical that we have clinical trials available to our patients at the Peeples Cancer Institute.
I've been hearing that they're now offering phase 3 clinical trials for the locally advanced, inoperable non-small cell lung cancer. What makes that so unique? Yeah,
so the lung cancer trial is the first one that we started, and we've already enrolled a patient on that trial. But we're planning to open clinical trials for nearly every cancer, rectal cancer, breast, prostate, head and neck. So we hope to be able to offer eventually to be able to offer every patient that walks through our door the option of a clinical trial with, advanced treatments that they, available to them that they might not otherwise receive. The difference between like phase 1, phase 2, and phase 3, it's a little nuanced. But it's an important difference. We are typically just offering phase 3. So basically phase 1 trials are trials that evaluate a given technology or a drug, a pharmaceutical agent, chemotherapy, whatever it is. But all they're really looking at for a phase 1 trial is safety. In other words, can I give this to a patient, and what are the side effects? They really want to just make sure that there's not extreme side effects, so to speak. They're not necessarily looking at, survival or effects, although that is sometimes a secondary goal. And typically phase 1s are at a limited number of institutions. Many times they're sponsored by pharmaceutical companies, that sort of thing. Phase 2 trials evaluate technologies and treatments that have demonstrated safety in a phase 1 trial, and they're expanded to more institutions and maybe a handful of institutions that offer it a treatment on a phase 2 trial. But even phase 2 trials, they start to look at the efficacy of the agent. It may be randomized, it may not be randomized. But again, they're looking at really a small subset of patients and looking to demonstrate at least both the safety and to a small degree the effectiveness as well. If technologies make it through phase 1, phase 2, then they're expanded into a phase 3. And a phase 3 trials, in my opinion, that's the biggest bang for your buck, so to speak. That's where you have technology that has shown itself to be relatively comfortable with the side effects of it from the phase 1 and the phase 2 trial. And then it also has had some indication of benefit in terms of, improved response, prevention of local recurrence, that sort of thing. Typically, a phase 3 trial is randomized, and it's available all across the nation. So hundreds, if not thousands, of institutions across the nation and across the world, many times. And typically, the federal government, will provide some level of funding. A phase 3 trial, in my opinion, is a technology that is right on the verge of becoming, standard of care, or at least right on the verge of being, expanded ubiquitously. So again, that's really where we're focused on our phase 3 trials, because, we believe that those are going to be the best options for our patients.
I love the way that you said it was the best bang for your buck with phase 3. Are there any more major benefits with doing the phase 3 trials?
So, typically with a phase 3 trial, the other part of it is there is a high level of oversight. So we're doing our phase 3 trials in collaboration with Peeples Cancer Institute of Emory University, and so there are multiple levels of oversight of patients on clinical trial, both at the institutional level, at our level. We have a specific nurse navigator that is dedicated to clinical trial patients, and she is only for clinical trial patients, and that is essentially like a personal navigator for these clinical trial patients that they otherwise wouldn't get. So they'll coordinate all the appointments. They'll coordinate all the lab dates. They're like literally calling patients almost on a daily basis to make sure that everything is running smoothly. So beyond that, there are, to Emory, there are clinical trials folks looking over the details of the clinical trial, how it's being executed, as well as the patients that are on the clinical trial. And even beyond that, many times at a national level, there is central review, of the radiation plan, the chart, the chemotherapy dosage, administration, so all of these sort of important factors. And so there is a high level of quality, and the trial sponsors want that level of quality. They want to be able to, we need to be able to compare the quality of treatment at any one of these institutions that are offering this trial. It has to be the same. And so that's what their job is, to make sure that, if a patient walks into Peeples Cancer Institute and enrolls in this clinical trial, they're going to get the same exact treatment as they would, they walked in anywhere else that offers this trial.
Why was bringing it here in Dalton such like a big milestone?
So if you look at, we haven't had a lot of clinical trial availability at all. There has been some, maybe some phase 1 trials available around here, maybe phase 2s. Recently, there really hasn't been a lot of phase 3 trials available. If you look at a map, for instance, for the trial that we just opened, it's a lung cancer trial. But if you look at a map of the availability of just that trial, really there's, it's offered at Emory and Atlanta certainly, but then around here, we're pretty much it. This trial, at least right now, is not being offered in Chattanooga. It's not being offered, anywhere else in this general area. So, yes, we want to offer Peeples Cancer Institute patients these clinical trials because we believe it's important, but we also view this as a service to the area. We looked around, we saw, this is important. No one else is really doing it, or at least for certain trials, no one is doing this. We need to be able to provide that service to this community.
That wraps up today's episode of Health for Life. Thank you, Dr. Ali, for helping us learn more about the important cancer treatment that is provided through clinical trials at Peeples Cancer Institute at Hamilton Medical Center.
Yeah, thanks for having me.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.